Welcome everyone to brain inflammations. So what are the inflammations of the brain? We could have meningitis, could be an abscess or a mass, or could be encephalitis. These are the things. So for meningitis, what do we do? Usually it's caused by, it's a bacterial, and it causes headache, fever, neck stiffness. Okay, how do you diagnose it though? It's a bacterial infection causes these symptoms. How do you diagnose it? First and best, lumbar puncture shows many neutrophils. So the diagnosis, lumbar puncture shows neutrophils. Okay, how do you treat it after you confirm that? Then you treat it either with ceftriaxone, everyone, and vancomycin for everyone, and then steroid for everyone. You add that to ampicillin only if immunocompromised. Okay, so that's the treatment for meningitis. What are the causes of meningitis? It could be caused by syphilis. If it's caused by syphilis, then you need to do the VDRL, RPR, and the CSF, and then you could give penicillin. Okay, so that's if it's caused by a syphilis. What if it is caused by Lyme? Then you want to do Lyme antibody test in CSF, and then you want to give ceftriaxone. What if it is caused by TB? You want to do acid fast TB. The acid fast bacilli will be positive, and then if that was positive, what do? You do ripe antibiotic. Do you know what ripe antibiotic? Yeah, I know. It's rifampin, isoniazid, pyrazinamide, and ethambutol. So this is if it's a TB meningitis. And it could be, what else could it be? It could be Rocky Mountain spotted fever. Rocky Mountain spotted fever. What do? You do Rocky Mountain spotted fever antibody and CSF. And then you treat it with ceftriaxone, same thing as Lyme disease. Okay. There are certain situations in meningitis called fails. If there's any of the fails there, fails, what does fails mean? Mean focal neurologic deficit for F. A for altered mental status. I for immunocompromised. All for lesions over the site of lumbar puncture. S for seizure. So if fails, what do you do? If fails, then what do? You give antibiotic first, and then CT, and then lumbar puncture. If no fails, then you do lumbar puncture, then you antibiotics. Okay, simple, just like how it used to be. Lumbar puncture and antibiotics. What if there was an abscess or a mass? What it could be caused? Could be caused by mass effect and present with fever, headache, except there will be additional of focal neurologic deficit extra. How do you diagnose it? First, you do CT scan with antibiotic. If there is AIDS and toxo-antigen positive, then what do you do in this case? You treat toxo with pyrimethine sulfadiazine and rescan. So you do pyrimethamine sulfadiazine. Okay, If no AIDS or not toxo antigen positive, then what do? You do biopsy. That's what you do, biopsy. If it's an abscess, then you give antibiotic. If it is cancer, then you do chemo and radiation. Simple and easy. And then you repeat CT scan for toxo showing improvement. Continue. If not, so for after you find toxo, so this is just a way to avoid the biopsy. So if you did that, you found toxo, good job, treat it permethamine, sulfadiazine, then repeat CT scan. If no improvement, then in this case you have to do biopsy again. So this is very interesting. Like, this is how you do it. Fever, headache, phoconeurgic deficit, you do CT scan. And then to avoid the biopsy, we test for toxo. If it's positive, we treat it. If it's negative, then we biopsy. If it's cancer, chemo, radiation. That's it. How about encephalitis? How do you manage encephalitis? Encephalitis usually caused by viral infection of parenchyma. Viral infection of the parenchyma. How does it present? Present usually fever, headache as usual, and then altered mental status. This is associated with that. It's important. How do you diagnose it then? You diagnose it first. You do CT scan with antibiotics. And then the best thing to diagnose, you do lumbar puncture. You want to check for lymphocytes and HSV-PR. You do lymphocytes and HSV-PCR. And then you treat it with a cyclovir if it's herpes. If herpes, you want to give a cyclovir. If there is, you follow up. If there is a flaccid paralysis, then this is West Nile virus. If it's a temporal lobe infection, then it could be herpes encephalitis. So these are basically how do you manage encephalitis. In summary, if there is a meningitis, first, the most thing, lumbar puncture, and then you give ceftriaxone, vancomycin, steroid, ampicillin. And then you follow up. If it's syphilis, you give penicillin. If it's Lyme or Rocky spotted fever, you do ceftriaxone. If it's TB, you do RIPE. If there's any of the fail at the initial presentation, phoconeurgic deficit, altered mental status, immunocompromised, lesion over site of lumbar puncture, as seizure. If present, then you give antibiotic first and then CT scan before lumbar puncture. If not, then you do lumbar puncture, then antibiotic. This is very important. Okay. If there is an abscess, usually phoconeurgic deficit, not instead of neck stiffness, besides the fever and headache. If you start with CT scan in this case, because phoconeurgic deficit, you see. If it's positive for a mass, then you do antigen. Or if there's AIDS, you do toxo antigen, you do pyrimethamine, sulfadiazine. This is just a simple test to avoid brain biopsy. If not, just biopsy it and treat it accordingly. If it's cancer, chemo, radiation. Encephalitis, usual altered mental status beside the headache and neck stiffness. And so altered mental status, this is one of the other things. Altered mental status, we said. This is phoconeurgic deficit, this is an abscess, this is encephalitis. Then you do CT scan. If there is a lymphocyte or temporal lobe, this is herpes encephalitis. You treat it with the cyclovir. If there's a flaccid paralysis, then most likely West Nile virus. And that's the summary of brain inflammation. Thank you so much for listening.